Good morning, everyone. My name is Dr. Carlos Loaiza. It's a great pleasure and honor to be here. In today, it will talking about a prognostic effect of hormone receptor status in early HER2, the positive breast cancer patients. This study was conducted to determine the prognostic effect of hormone receptor status in patients with HER positive early breast cancer and to assess prognosis. We obtained data from 299 patients with early HER2 positive breast cancer who underwent surgery and received standard adjuvant chemotherapy, hormonal therapy, and or radiation between 2000 and 2002 at the National Institute of Neoplastic Disease, Peru. Patients and methods. Acceptive adjuvant treatments were chemotherapy, endocrine treatment, and local radiation, all of which have to have been administered according to international guidelines and or local guidelines. No patient had received adjuvant rituximab, as at the time it was not a standard treatment choice. Follow-up after completion of adjuvant treatment usually involved a regular schedule of visits every 4 weeks, initially which was progressively extended to every 6 months, except for patient recurrent more frequent visits. Patients had regular blood tests and imaging tests. The results table 1's comparison of demographic disease characteristics in treatments by hormone receptor status in early HER2 positive breast cancer patients. Data for this retrospective analysis were obtained from 299 patients with HER2 operable breast cancer. The average age was 49 years. In total, 155 patients had positive HER, 51.8%, 122, 44% had poorly different tumors. Lymph node involving meat was observed in 158 cases. Most patients underwent radical mastectomy and most also received adjuvant chemotherapy, but this included taxane. Aside from these different patients, characteristics were comparable between the two groups in terms of age, menopausal status, histological types, T name and pathologic STGs, 1, 2, 3 stage, type of initial therapy and use adjuvant chemotherapy and radiation. The table 2 observed field recurrence by hormone receptor status in early HER2 positive breast cancer patients. The most frequent localization of recurrence were bones, lung, liver, and ipsilateral supraclavicular lymph nodes. In general, all recurrence localizations except the bone were more frequent in the HR group. The median follow-up time for all patients was 93 months. During this observation period, 19 patient developed disease recurrence at the local, regional, or distal level, and 55, 18% did. Steroid receptor status and survival. Figure 1 recurrence in HR2 positive and HR negative versus HR2 positive mass HR positive populations. In low rank testing, HR2 positive and HR negative patients were significantly more likely to relapse than HR positive, and the patient given 5 years breast cancer-free survival rates of 65% and 74%. The favorite two decide-free survival in HER2 positive and HER negative versus HER2 positive and HER positive population. In the multivariate co-regression analysis, the only covariable which significantly effective on the time to recurrence was pathological compromise of axillary lymph nodes, as should the absence of HER increased, the recurrence risk be more than 1.7-fold over the presence of HERs. The discussions in the breast cancer is a heterogeneous disease, although there are hormone receptor and HER2 status are not as accurate as genetic analysis. It is clear that information on receptor status is much more validated and can provide us with an extremely useful tool for obtaining information about the behavior of the disease. Our results showed that for the general population of HER2 positive patients, the HER negative group has a higher rate of aggressive features such as for differentiation and extracapsular extension than in the HER positive population. Thanks you for your attention.